If you are on hospice and you want to do the right to die, hospice should and can get you that information.
Enjoy your last moments. Take that shot, 3 shots, whatever you'd like.
Nick Shirley is going after a nationality, a culture. It's not just the fraud he's going after. He's making the name of the Armenian name louder than the fraud to me.
I mean, I'm part Filipino. Filipinos were doing the fraud too.
It doesn't matter what time it is. Hospice is 24/7, and if you're not 24/7, you're not a hospice. I'm like, 15 CERP periods in 10 years? I'm like, what the flip happened there? One girl, I love what she wrote. She goes, "Thank you for allowing me to be a daughter and not a caregiver." Sometimes your doctor doesn't know, and sometimes it is you who's saying, I'm advocating for myself.
Hi, and welcome to the Key Concepts podcast. Today's episode, we're going to talk about hospice care, and specifically, we're going to get into some of the hospice fraud that we've been seeing in California, especially with some of the stuff that Nick Shirley has exposed and how it's kind of impacted the Armenian community. I'm really excited to be joined by my special guest today, Esther Nassisian, the Chief Operating Officer and co-founder of RC Hospice Care, and Timothy Henderson, the Assistant Director of Patient Care. Thank you both for joining me today.
Oh, thank you for having us.
I am so excited to be here.
What is hospice care?
Hospice care is for those who have been diagnosed with a terminal illness. And the statement that we get in hospice, every single patient, they can't get onto hospice without this certification of terminal illness by 2 physicians that state this patient has 6 months or less to live if the disease takes its natural course.
I can't just come and enroll into your service.
It has to be 2 physicians who certify the patient. So the main physician is always the patient's primary care doctor.
Or sometimes it's an ER doctor.
Absolutely.
Or
the doctor will then send the referral, which is the first form of certification. And then our medical director will then review it to make sure that he also concurs. And then our directors of patient care services, whether it be Kimmy or Tim, will look over all the H&P, which is the history and physical, to make sure that everything that's on there is accurate and it matches what the patient looks like. Because sometimes on paper, they look healthy as can be, but
she looks healthy, she's talking, she's eating great, but she has cancer that she was just diagnosed. So it's the internal that I'm not seeing of the cancer that's eating away, or kind of the diagnosis.
When people are terminally ill and they are enrolling into hospice, what are the pros and cons of it?
Hospice is your new 911. You have a nurse available 24 hours a day. So if maybe grandma had a fall at night and she hit her head, you're going to call hospice and not 911. There are some times where you can send your loved one to the hospital if it has nothing to do with their hospice diagnosis. But our main goal is to take care of your needs in the home.
The important thing is for patients to understand, or their families to understand, that just because they're on hospice doesn't mean that they're not going to get treatment for other things.
How do you deal with a patient who's more resistant to the medication? Like, what do you do in those situations?
There's something called stacking on the liver. And until the liver starts processing the medication, they don't normalize. I've had a patient start on a fentanyl patch. They slept for 12 hours. And then they woke up on that same patch, completely normal, no pain. They felt amazing. 4 days later, they're having pain again because guess what? They've built a tolerance. The liver's stacking they need a little bit more.
But how do you deal with the patient who then becomes like verbally combative and abusive?
The pharmacies will mix medications together whether it be in a cream form, a patch form, or whatever the case may be. And we can put it on a glove and just, hey, grandma, how are you doing today? You doing okay? And because we have thinner skin in specific areas, the nurses, I've learned a lot, you guys. They know exactly where to put it on. And then within like 15 minutes, grandma's calmer.
You just have to find the right dose for them. And it could take a little while till we find that right concoction for these patients. Maybe it's a start, they're falling asleep. Okay, let's find that right concoction that works for them.
Let's do a little bit less next time.
Does that lead to elder care abuse? And what is your guys' process when you guys identify that?
Unfortunately, the APS cases or the abuse cases, we get them way later. And then now we're chasing symptoms. We're chasing issues and how can we fix it? It's very important that all of our staff in every hospice agency knows what lines not to cross. But what can I do? We're mandated reporters.
What is graduating off hospice care?
So sometimes a doctor might think Mima's going to pass away within 6 months or the period given. Well, those 6 months have passed. Mima's doing great. Beforehand, when the doctor saw her, she's not eating, she's not drinking, but now she's up 20 pounds. She's eating, she's drinking, she's getting better. So that's when we would graduate them from hospice and put them onto our palliative care program so we can continue to monitor them and help them with any doctor's appointments they need. They're no longer, as quote unquote, seen terminally ill, or the doctors don't think they're going to pass away within those 6 months.
What advice would you give caregivers that are trying to take care of their parents or grandparents that are just burnt out? Like, what options and resources do they have?
So one of the resources that we provide is respite care. It's a 5-day period that we give to our patients where we give that family that break. The patient would go to a skilled nursing facility for 5 days. That way the family can get a breather. They can maybe go on that vacation that they wanted to. I think one time we had a patient where the wife really wanted to go see her newborn grandbaby, I think, in Texas, but she's taking care of her husband. Well, she was able to go see her grandbaby because we were able to provide those 5 days of respite care. So she got a little refresher, came back refreshed and ready to care for her husband again.
Armenian in the hospice field.
Oh, man.
Tell me about RC Hospice and the impacts from all that fraud.
What sucks is when they're screaming, Armenian, Armenian, Armenian. Were Armenians doing it? Absolutely. But there were so many other nationalities doing it too, Corey. And when the loudest one is your nationality, you want to keep your head down and go in a corner and be like, oh my God, here we go again. Why is this happening? We're Joint Commission accredited, okay? We have the highest accreditation. We've passed every audit flying colors.
Have you seen other hospices get shut down, and has there been an influx of calls?
No, I can't say we've gotten crazy referrals because of the hospices closing or we've gotten transfers. I think we got 1 or 2 that were transferred from us from one of the hospice agents. And it wasn't a transfer. It had to be a whole new referral because for me, I have to do it the right way. I will tell you the growth that's been happening, it's word of mouth. The frauds happening, I think, is causing a lot of people to do research. They go and they read the reviews. They call. I always tell people when they call me and I'm supposed to give them the hospice spiel, I'm like, listen, I don't want you to choose me. I want you to call every single list that they gave you. Call all of them. Ask them this question, this question, this question, and this question. And if they can do those things for you, you don't have to go with me. Go with them.
How does that fraud work in the first place? Like, if someone was to conceptually go through that path, how would they do it?
So hypothetical again, doctors are in on it. There was one hospice company I read about. There was no doctor. And there was another one where it was a clinic. He had a whole clinic. He was prescribing things. No one was checking. I had heard a story about a hospice agency. They're adding them, using a cert period, taking them off. Adding them, using a cert period, and taking them off. Because remember, these patients have certification periods. You can bill for 90 days and then take them off. And they're billing per certification period. I'm like, 15 cert periods in 10 years? I'm like, what the flip happened there?
On some of the videos, I'm seeing like ghost hospices. There's hotels, addresses, and you're talking about certification. So how can Medi-Cal or Medicare bill for something that doesn't exist?
Every time you move, you have to submit a change of address and then change of location form to the state and to Joint Commission, to everybody. They have to come do an audit. The guy comes, he checks everything, makes sure everything's locked, the dual locks, whatever, everything's in place. He said, we have to make sure that this is a working office. So the shell companies, from my perspective, what's happening is they're staging it, they're coming, they're giving the certification. Then they're like, okay, we don't need to be here for the next 2 or 3 years until accreditation happens again. We can bill from home or do whatever, save this money too. Can a hospice agency technically work from someone's house? Yes, and here's why. The nurses and all of the staff are working outside of the office. The office is like a hub where they can come to chart, they can come to have their IDT meetings, they can come to do their notes, visit with their directors, meet with each other. There's still staff at the office. We have our intake. I mean, there's always 10 people in our office. Like, we have a lot going on. So a lot of these shell companies, to me, it's probably like a small hospice company and they have like 6 employees and they're like, why do we need to be in the office 24/7? Now, is that right? No, you should be in the office because that's the correct thing to do. But can you be in your home and still run a hospice agency? Absolutely. My phone is 24/7. Whenever Nick Shirley's showing it and it's one desk, that doesn't make sense to me. I get what he's saying. But again, I wish he would elaborate a little bit more and take the Armenian out. It's not just the Armenians. There's so many fraud happening. I don't want to name hospitals, but a hospital got sued for $144 million. No, you want to know why they weren't in the headline? They got money to cover that. But Armenians are so stupid. I'm going to say it. Yes, so stupid sometimes. What are they thinking they're getting away with? You know? Anyway, my point for that is, Armenians, please do the right thing.
The homelessness, do you think that's integrated into the fraud?
I think absolutely there's integration there. Have I seen it in Sacramento? Absolutely not. We actually have had a few hospice patients who were homeless. They were 2 brothers.
Mm-hmm.
One got adopted. Then when he turned 18, went and found the other brother. They were both drug addicts. Then one became a pastor. Crazy story. And then the younger brother became a homeless. The older brother had a home. The older brother dies on our hospice. Then the younger brother gets on, but he's homeless and he's so used to being homeless, Corey. He still sleeps on the sidewalk. He does not want, his brother left him his house, but he won't sleep in the home. It's horrible. Mm-hmm. So I go to this tent and he's like, why don't you come in and have a seat? I was like, where do you want me to sit? And he's totally laughing because he knows it's funny. He's like, the same place I'm sitting, on the floor. And I sat on the floor with them. I'm like, okay, let's do this. Let's do the consent forms. And my nurse is like, we're really doing this. I'm like, don't worry, someone's coming with you every single time. But what can you do? You know, I mean, that's where they live.
Yeah, I mean, that's actually a homeless that actually needed it, was on it. Do you think that the homelessness is also part of an integration point where a lot of fraud happens?
I would say yes. One of those things that I heard, I don't know if it's true. It's obviously TikTok rumors.
Go ahead.
is
TikTok.
that mortuaries were involved in it too. That they were getting patients who had passed and backdating when they had passed and saying as if they're on hospice.
So if they get on hospice, we don't bill until, let's say, either they pass in that month or the end of the month. So people were dying on the 29th of that month, and they were seeing that there was no hospice ever done because they have access. Mm-hmm. They were backdating for that full month, getting that payment for it, putting in those fake notes or visits or whatever, collecting the money, and no one was catching them. I heard it went on for almost a year and a half until one of the family members gets an EOB. And she's like, hospice? She's like, my dad was never on hospice. Like, why am I getting this? And an explanation of benefits is like a receipt, like of what was billed. This is what Medicare paid for, blah, 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 blah. She contacts Medicare and says, this never happened. Bam, ripple effect. Investigation opens up. I think there's like 16 people went to jail. Nick Shirley is going after a nationality, a culture. It's not just the fraud he's going after. He's making the name of the Armenian name louder than the fraud to me. If there is fraud, there's a way of processing fraud. Contact the government. You have the right to complain. You have the right to choose another hospice. You have the right to participate. And there's 3 phone numbers on there. California Department of Public Health phone number for the complaint line, Joint Commission grievance line, and then there's the RC Hospice grievance line, which means you can even call us to report whatever's needed. But the fraud is there's a way of reporting it. Yeah, go out there, do the news. That's great. Get the fame. I'm not talking crap, I swear. But did you contact the government agencies, Nick Shirley? Did you give them this information? Say, hey, these are shell companies. Because I promise you, Corey, if someone does it that way, the government is not stupid. They're going out there. They're like, okay, thank you for telling me the red flag. I'm going to come.
And you being adopted Armenian, Tim, how do you feel about this?
I think there's also other cultures that are involved in the fraud and they're not being as highlighted as well. I mean, I'm part Filipino. Filipinos were doing the fraud too.
Oh, yeah, because a lot of Filipinos are nurses, right?
Yeah.
That's like
why do you think I'm a nurse? I had to follow the Filipino way.
I love my ates.
I'm going to plug in Theo Von here for a second because it just came to my mind about the Filipinos and nurses. But if you haven't seen this skit with Theo Von, he's like, I love Filipinos. They're like the first people that welcome you, and they're the nicest people when they see you pass. And it's a whole skit, but it's hilarious. So
I'm going to watch it.
Have you guys seen anything with pets and animals? Like, do we see people just signing up parrots and blue jays and pigeons and stuff?
I wouldn't know. I haven't. Have you?
The only thing that I've heard is that there's palliative care for dogs. And I'd be the crazy pet parent that would absolutely sign my dog up for palliative care or hospice.
Yeah. I have heard there is a dog hospice, but I don't know if the billing works the same way.
No, I don't think Medicare would cover it.
No, it's not.
But
it's not a government insurance.
I don't know.
Like Care Credit might cover it, but that's like a whole different avenue.
What questions should they ask a hospice provider to make sure that they're not getting a hospice that may be cutting the corners or doing some fraud?
One of the ones that I love to ask is, after hours, how long will it take for a nurse to come out if I need someone? What's going to be the answer for that? How long will it take to get medications? How often is the bath aide going to come out? How often is the nurse going to come out? How is your continuity of care? A lot of other agencies, you might see 5 or 6 different nurses. We just had a patient that they transferred from the agency to us, and they were shocked that they're seeing the same 2 nurses their whole time of care. They said, last time I was on hospice with the other agency, we weren't happy with them. I saw 10 different nurses in a span of 2 weeks.
How am I going to make sure that they're not going to do fraud?
Do they practice what they preach?
Yeah.
When they say they're going to come out once a week, are they coming out? Are you seeing the supplies? Are you seeing the medication? When you're asking for something, are you getting it? Another thing is the EOB, as I mentioned earlier, the explanation of benefits. You get that every single month. Medicare, Medi-Cal, any insurance you have is going to send it to you. And they're going to say, hey, this was billed for hospice care.
So that's a good point. I mean, the proof is in the pudding. Once you are on that hospice, if they aren't following through as they said they are, then they're probably billing for some of the services. They're probably cutting corners, or they're probably not a hospice that you want to go with. How do you switch? Is it easy to switch?
Transfer. Same day. I've seen it. We've done one at 1 a.m. in the morning. That's my favorite story that you have. Is we have a patient. Hospice isn't coming out. They've called the hospice. Well, take this. Well, the medication's not working. The nurse, they didn't want to send a nurse out.
I'm going to sleep. I had the craziest day of my life that day. So I'm getting ready to go to sleep finally. I put my head down. I get this call and I'm like, she never calls me this time. I won't lie, I ignored the first call. She calls me again and she knows it. She's calling me a second time. I pick up, I'm like, hey, what's going on? She goes, I need your help. And she goes panicking for one of her best friend's moms on hospice. I'm like, get me on the line. Let's three-way with the patient's daughter and let's call the hospice agency. We'll make them come out. They're supposed to come out. That's what it is. We three-way the hospice agency and I'm just listening for now. Cause I'm like, I told her what to ask. She's screaming. You can hear her in the background. I think that was the saddest part for me. I'm like, she's screaming. She goes, well, we educated you on the medication. You should give it to her. She goes, I did give it to her. It's not working. Well, you can technically go up on those. She goes, I'm not comfortable going up on the dose. Well, we can probably get a nurse out there in like maybe 2 or 3, 4 hours. Literally, that's what she's saying. I'm listening to this. I'm like, is this a joke? And this is a freaking hospice agency. It doesn't matter what time it is. Hospice is 24/7. And if you're not 24/7, you're not a hospice.
You guys also have the Joint Commission Gold Seal. So what is the Joint Commission Gold Seal and what does that mean for our hospice?
Joint Commission is the gold standard. It's the highest accreditation nationally for your quality of care. And their standards are like higher than the state's core. Like you have to have things in place. The first surveyor taught me this. He's like, I'm not here to shut you down or tell you you can't do it. I'm here to help you be the best because we need this care in the community. I want to point out what you're doing wrong so that you can fix it. Joint Commission has an early survey thing where you can pay them to come out. I am doing this mock survey. I need to figure out what I need to figure out. Like I want to be the best. I want to keep the gold seal. There's so many hospice agencies, including in Sacramento, that lose their gold seal and they go to a different accreditation because it doesn't require as much.
What would be some signals that would cause you to lose that seal?
A nurse has to go out once every 14 days. They have to do you could talk about this
supervisory visit, where it's an RN that has to see them every 14 days and doing a full head-to-toe assessment, making sure that all the symptoms are well managed.
And if that's not done, the supervisories aren't done, the checks on the home health aid supervisor is not done. They have to make sure that the quality control, which is what's supposed to be done, if they'll catch it. If you're in the red, especially in the last red where it's high and you're widespread, that's like a resurvey, which means that sometimes they'll revoke you or they'll say, I'm giving you 30 days and I'm coming back and I'm not telling you when I'm coming back, but I'm coming back. And technically it's something you could technically fix tomorrow, right? They might come back tomorrow. You don't know that.
Beyond the seal, what makes RC Hospice stand out amongst the other hospice care providers?
One of our big things is our continuity of care.
Continuity 100%, but I will tell you it's the people. If Kimmy's not there, Kimmy's been with me for 10 years. Our comfort care, our treatment plans, our plan of care, she has been the mind behind it. It's not, listen, what I come for is I'm the person who makes the call. We're not jumping hoops to figure out, are we going to make this change? No, it makes sense. That's the smartest thing. We're not going to go through 50 different people to get an approval. It's going to happen. Tim is the difference. I've had Tim come up to me like, hey, I really think we need to get a wound vac for this patient. And hospices don't cover wound vac. I'm like, tell me why. He gives me the explanation. You're absolutely correct. I am going negative now because a wound vac is a very hard thing to have on hospice. No problem. We're doing it because Tim said so. That's the difference. You have a team who's treating you like they would their own.
Is there anything else about hospice care that we didn't touch base on that you kind of want to bring up?
Sometimes your doctor doesn't know you need it. And the patient calls him and he's like, I want you to sign me up for hospice. I know he's been hospitalized 6 times in the last month. And the doctor goes, why are you throwing in the towel? I think that's really messed up. We admitted the patient. He passed away 3 months later.
Now, if someone does want to reach out to RC Hospice, where can they find your socials, your phone numbers, your websites, and contact information?
RC Hospice, just like that, is our main Instagram page. We post information, events, how to contact us. But that's more for, you can follow us until God forbid, but if you don't need us sooner. But if you do need us, there's information there. But the main way is you call us at 916-858-1440 or go to our website, www.rchcinc.org. That will then take you, there's an agent you could talk to on there if you don't want to call in, but you can even fill out a form. It'll come to an email. And with the live leads, we get back to you within 24 hours, a lot of times within like 2 to 3 hours. But the biggest thing is reach out to us, call us. It's about being available. And we are available for you if you need us.
I want to thank the RC Hospice team for joining us today, for sharing not only their expertise, but also their heart behind the work that they do. Hopefully today's conversation helped answer some questions for those that are out there that are in need of hospice care and cleared up a few misconceptions. So thank you for watching the Key Concepts podcast, and we'll catch you on the next one.